Thank you very much. I'll be speaking on bearing the unbearable, endometriosis and pelvic pain. So endometriosis affects 1 in 10 reproductive age women, or about 1 million women in Canada. So it's a very common condition. And it's defined as tissue from inside the uterus or the womb, which somehow grows outside of the uterus. So on the top left is a laparoscopic surgical photo of the uterus, and somehow this tissue is able to grow outside of the uterus and has the classic appearance of this dark pigmented tissue shown in the second photo. And if you surgically remove this tissue and look under the microscope, you'll see cells that resemble cells that come from the uterus. Endometriosis is associated with pelvic pain and infertility. And the pain symptoms range from painful menstrual cramps to more chronic pelvic pain to painful bowel movements to painful sexual activity. But it's very heterogeneous. So someone with endometriosis can have all those types of pain. Another person with endometriosis may have very minimal pain. And the same thing with fertility. Some women with endometriosis have totally normal fertility, and others have difficulty conceiving and require fertility treatment. Studies have also found an association with abnormal menstrual bleeding, a slightly increased risk of pregnancy complications such as early delivery, certain autoimmune conditions such as MS, heart disease, and a small increased risk of ovarian cancer. The treatment of endometriosis can involve several aspects. So one is hormonal therapy, and the rationale is that endometriosis is an estrogen-dependent condition. And so the hormonal therapy utilizes progesterone to antagonize the estrogen. The treatments include the birth control pill, which has progesterone and estrogen, as well as progesterone-only treatments. And this works really well for a lot of patients, but for a subset, they have side effects and they cannot tolerate it, or this hormonal therapy is contraceptive, so if someone's trying to get pregnant, it's not an option. Another treatment avenue is laparoscopic surgery. So that's surgery through small scopes, through small incisions, and that's how endometriosis is formally diagnosed and can be removed. So the photo here is showing some laparoscopic scissors which are cutting away endometriosis, which has a whitish color in this particular patient. And good clinical trials show that surgery can partially improve pain and can also improve fertility. Thirdly, there's an increasing recognition of the importance of allied health care, so physiotherapy, psychology, and counseling, because there's more recognition of the role of the musculoskeletal system and the nervous system in endometriosis pain. While some patients do get pregnant after surgery for endometriosis, there is a subset who will require fertility treatment at a fertility center. So to demonstrate the impact of endometriosis on a patient, I'm going to go through a patient's journey. So this is Sheila. She's an amalgamation of different patients we've seen at our clinic. So we'll start when she's 16. So her periods have been painful since they first started. Now she's starting to miss school. She's missing sporting activities. So she may talk to her friends or perhaps a doctor, and she's told, well, period pain is just normal. However, moderate to severe menstrual cramps, especially that affecting quality of life and function, is strongly associated with endometriosis. Moreover, there's now evidence that a history of painful periods month after month, say starting at adolescence, is a risk factor for future issues such as chronic pain. Therefore, this is a symptom that's important to be acknowledged and validated and addressed. Well, Sheila's now 22. She's been taking anti-inflammatories such as ibuprofen, and she's been managing. But now she can no longer take these medications because she's developed an ulcer. And we see this not uncommonly in our clinic. So she stops the anti-inflammatories. Now she's having pain on most days. So even without having a period, she's having a pain almost every day, and also having pain with bowel movements. And she starts using a hot water bottle on her abdomen. And what this does is it can cause discoloration of the skin, and we call this the hot water bottle sign. So if we see a patient and we see this, we know she's having significant pain and using a hot water bottle for long duration or frequently. So she sees her doctor, she's prescribed hormone therapy, and she's better. There's improvement. She has some side effects. Often we see mood side effects, but she's able to tolerate it, and she continues on with her life. So Sheila's now 30, and she's been noticing that sex has become increasingly painful. And she, again, may talk to her friends or see her doctor, and she's told, well, you just need to relax. Or we have some patients where in the past, a doctor told them, drink some alcohol and you'll be fine. Well, this is not particularly helpful, so sex is still painful and results in significant stress on the relationship. And similarly to menstrual cramps, painful intercourse is a symptom that's important, that's not uncommon, that needs to be addressed, and there's a variety of causes, of which endometriosis is one. And this can be treated, and this symptom can be improved. So Sheila's kind of living with this. She's now 32. Now the wrinkle, she's trying to conceive, so she has to stop the hormone therapy. So once she stops that, her pain goes up to 10 out of 10, and the stress just increases. Because in addition to the pain, now she's trying to conceive, and there's the month after month of disappointment when the period comes and the pregnancy tests are negative, and everything is just compounding. And so she goes to her family doctor and says, finally, I really need help. So thankfully, she is referred to a gynecologist, and she has the luck to see my boss and my practice partner, Dr. Catherine Allaire, who is a world expert on endometriosis. And the pelvic exam is done, and it's uncomfortable. So as I mentioned earlier, endometriosis is only formally diagnosed with surgery, but an experienced clinician, based on the history and a very careful pelvic examination, can have a very high suspicion of endometriosis even without surgery. So Dr. Allaire completes the examination. She tells Sheila, I think you very probably have endometriosis. And Dr. Allaire also notes pelvic floor muscle spasm. So these are the muscles around the vaginal canal that can go into spasm and become painful to palpation. And she also notices evidence of sensitization of the nervous system. So all pain ultimately is transmitted and perceived by the brain and the spinal cord. And in pain conditions, what's seen is that the nerves in the brain and spinal cord, they become more sensitive and they start to be overactive. And there's increasing role of the importance of this phenomenon in endometriosis. And it's not that endometriosis grows on the pelvic floor muscles or it grows on the nervous system, but having endometriosis is a risk factor for developing these other conditions which can compound pain. And a sign of sensitization, for example, is issues with the bowels and bladder. So someone can notice going to the bathroom more frequently, or issues with constipation or diarrhea, or even both. So Sheila undergoes laparoscopic surgery at Dr. Allaire at Vancouver General Hospital, and she's diagnosed with deep endometriosis. This is a specific subtype where the endometriosis results in adhesions between the uterus and the ovaries and the colon. And Dr. Allaire removes all the endometriosis, the pelvic organs are returned back to their normal location, and the surgery is a success. Now, Sheila had consented to a research study. So the endometriosis tissue, after it was removed, it was sent for some genetic studies, and this resulted actually in a landmark study, and this actually did happen. We have a research program where endometriosis tissues from surgery are banked, and these tissues were sent to the ovarian cancer research team, particularly Dr. Michael Anglizio, Dr. David Huntsman, and gene mutations in deep endometriosis were discovered. And this was published last year in the New England Journal of Medicine, and Pamela Fairman had an article in the Vancouver Sun last year. It's an example of how patient participation and community participation in research can have major impact nationally and internationally and really change a field. So surgery is done and her pain is improved, but some pain she's noting is still a bit persistent, particularly the sexual pain. So she undergoes interdisciplinary care at our clinic, the BC Women's Centre for Pelvic Pain and Endometriosis. This involves a physiotherapist, counselor, psychologist, and the goal is to address that pelvic floor muscle spasm and the nervous system overactivation. So one aspect of interdisciplinary care is pain education. So it's disseminating knowledge that the nervous system is not static, it's plastic, and pain can be changed. A pelvic floor physiotherapy addresses that pelvic floor muscle spasm, and psychological approaches, which Dr. Brotto will be talking about, things like cognitive behavioral therapy, mindfulness-based therapy, help to desensitize the nervous system. So Sheila's now 31. She's undergone surgery. She's undergone the interdisciplinary program, and her pain has definitely improved. However, the issue is she's still not pregnant. She has a friend with endometriosis who has a child after seeing a fertility center, and they're very happy with their care they've received. But let's say they mix things up and they decide to go the adoption route. So she's now 32. They've done all the adoption paperwork, and finally their son joins their family. And then that weekend, she misses a period for the first time. So that actually happened. My son Zachary came to live with us on Friday, and then my wife missed a period on the weekend, and then that Monday she texts me positive pregnancy test for the first time. So it doesn't always happen so serendipitously, but it can happen. But the point of this slide is this curve on the left. So on the x-axis is the number of months after surgery. On the y-axis is the chance of pregnancy. And the different colors represent different types of endometriosis. So for some types, the chance of pregnancy after surgery is actually not that high. But for other types, the chance of pregnancy goes up to 80% 3 years after surgery. The main point is that these curves increase slowly over time. So it's not that everybody gets pregnant right after surgery, but you can get pregnant at 6 months, 12 months, 2 years, 3 years. And in Sheila's case, it happened a full 2 years after the initial surgery. So 9 months later, she delivers a healthy girl, but a little early by cesarean section. And I only mentioned that because of this research showing that endometriosis is associated with a slightly increased risk of pregnancy complications. It's not a high risk, but it's been shown reproducibly, and a lot more research is needed into why this is the case and how this can be prevented. So let's fast forward almost 20 years. Sheila's now 50. Her daughter is a teenager, and she has painful periods. Now, endometriosis has a partial genetic component. It's not a genetic disease where if one parent has it, the child's going to have it, but there's a partial genetic component. And researchers have identified approximately 12 areas of the genome which seems to be associated with risk of endometriosis. And they're getting closer to dissecting which genes in these 12 areas are actually causative of endometriosis. Anyway, Sheila seeks early medical attention for her daughter. And we see that not infrequently at our clinic where we'll see a young woman with her mother. And her mother has endometriosis, may have had years of pain, had to undergo a hysterectomy, and her mother doesn't want the same thing for her daughter. So her daughter's symptoms are validated, they're addressed, treatments are offered, and hopefully this prevents future problems such as chronic pain. So finally, Sheila's now 65 years old. She's gone through menopause and all pain is resolved. The reason is that endometriosis is an estrogen-dependent condition. So after menopause, the ovaries are no longer producing estrogen, so almost all endometriosis will resolve after menopause. And so she's completely forgotten about the diagnosis. She's living her life, and then one day, she's noticing abdominal bloating and discomfort. And so she reads online, and she sees endometriosis associated with ovarian cancer, and she gets very concerned. So she sees her doctor, and thankfully, her ultrasound's normal. So there have been a number of studies showing that endometriosis is associated with a slightly increased risk of certain types of ovarian cancer. And the ovarian cancer research team, OVCARE, which is one of the VCHRI centers, has been instrumental in showing genetic evidence for this relationship. However, the risk is small, and so the vast majority of women with endometriosis do not develop ovarian cancer and have the same situation as Sheila, where everything is normal. But for that subset who are at risk for ovarian cancer, the OVCARE team is working hard to identify ways of prevention and perhaps early treatment. So I just want to leave you with some resources. So womenspelvicpainendo.com is our clinic website. It has a lot of handouts and videos. The second one is the Canadian Endometriosis Network. Endometriosis.org is a reviewed website. It's very accurate and very well done. And finally, I just want to publicly thank the VCHRI for supporting my salary over the last 2 years through the Mentored Clinician Scientist Award. Particularly, I want to thank the foundation and all the donors because this award made a huge difference in my career. And I want to thank the Women's Health Research Institute for supporting our endometriosis research program since its very beginning. And with all this support around us, we've been able to get national funding to continue our research program, and we hope that we'll have direct impacts and improvements for patients with endometriosis and their families. Thank you.